Hi, Mrs. Smith. It's really nice to see you again. I see you're back to follow up on the stroke you had. How are things going for you at the rehab facility?
Kind of slow.
Kind of slow?
Yeah.
What kinds of things have you been doing in your rehab?
Oh, they have me doing all kinds of things and different machines and stuff. Yeah, it hurts.
It hurts? Oh, I'm sorry to hear that. Where are you having pain?
Well, just about every joint, especially my knees.
Yeah.
They're really,
Yeah.
they have me doing some leg things that is it really necessary?
Well, I understand that pain is hard to work through, but a lot of times when you're having rehab after a stroke, that pain is telling you that your muscles and joints are starting to work again. So you can kind of think of it as a positive way to, know that your body's getting back to normal. So,
Okay.
But what are your goals for the long term?
I want to go home.
Oh, of course, of course. And what are the things that you'd like to be able to do once you get home?
Everything. I want to play with my dog. I miss my dog. I want to cook for myself. I'm a very independent person, and I want to do things for myself.
Yeah, yeah. And so that's a very important goal, to be able to get back home, to be able to get back to your independence. Have you thought about what it might take to get there?
I guess the rehab.
Yeah, you're absolutely right. And it's also going to be very important that once you're home, you're able to continue on a regular activity program. Have you thought about what that might look like?
Not really.
Not really? Okay. Well, have you ever heard of something called Tai Chi? Is that a familiar term to you?
Yeah.
You've heard of it?
Oh, I have.
Okay.
I have a friend who does it, and she just raves about it. She loves it.
Well, Tai Chi is one of the best ways to get your balance back after you've had something like a stroke, and it's also really good for preventing falls. And if you want to be home and you want to be doing the things you want to do and going for walks with your dog, it's very important to make sure that you don't fall, because that could cause more problems down the road.
Absolutely. I do not want to fall, for sure.
So what do you think about Tai Chi? Is that something you think you might be able to try sometime?
Well, I hadn't really thought about it, but yeah, I guess. Like I said, my friend talks about it, and it's very pretty. I've seen pictures,
Yeah. Well, it's not that easy to get started. You do certainly have to have some motivation to want to do it. And when you first start, oftentimes you do feel a little wobbly or a little insecure.
Well, I don't see how I could do it. I'm still in a walker,
Yeah, I understand. So there are lots of places around that have it. Your local senior center would have it. And what I recommend is that you start by doing it in a chair, just sitting in the chair.
I could?
You could. You can talk to the instructor, and that way you won't fall. You'll feel confident, and you'll start to learn some of the moves. And then gradually over time, as you get a little bit better at doing the moves in a chair, you can start to stand up, use the chair to lean on, and then eventually you'll be able to get to the point where you can do it on your own.
And you really recommend this?
It cuts your risk of falls in half. It also helps to reduce pain, although that's not a short-term benefit. You do have to stick with it for at least 3 to 6 months to have it help reduce your pain. But it does have a number of things that I think would get you to your goals of being home and able to play with your dog and doing your own cooking and things like that.
You do Tai Chi?
I do Tai Chi. I do it 3 days a week, and it's really helped my balance as well.
Oh, okay. Well, yeah, listen, anything that's going to get me home. And if you do it and you recommend it, I'll try it.
All right. Well, I'm delighted. It's a pleasure to see you again. I hope your rehab continues to go well, and we can talk some more about this at our next visit.
Okay.
All right. Thank you for coming in.
You're welcome. Thank you.
Hi, Mrs. Smith. My name is Terry. I'm one of the nurses who works with Dr. Fields.
Well, I remember you. Yeah, I think we met once before.
Yes, I think when you were in last time.
Right.
And I know that Dr. Fields talked with you last time about maybe trying a Tai Chi class to see how that would go. And I wanted to check in with you and see how Tai Chi went.
Well, I went once.
Uh-huh.
Yeah, and it was very, very beautiful to see. And the instructor's really nice, but I felt kind of self-conscious because I'm still in my walker. And I had to sit in the chair. I couldn't, do what they were doing. So it was, I simply felt self-conscious.
So you thought it was beautiful.
I
and
did.
You liked the instructor, but you were a little self-conscious because you were in a chair.
A lot self-conscious.
A lot self-conscious.
Yeah.
What were you hoping to achieve with by going to Tai Chi?
Well, like Dr. Fields told me, that it helps with balance, and I'm still having the wobblies, so I was really hoping that I could get to the point where I could benefit from what they have to offer. Yeah, mostly my balance.
So you're hoping it would help with balance, but you didn't see maybe the results you were looking for. Not yet.
Yeah.
What is your overall goal? What are you working towards?
I want to go home. Yes, I really do.
And what is it that's important to you about getting home?
Everything. I want to be with my little dog. He's really so cute. And I miss my garden.
Yeah.
And I just miss being independent, going to sleep when I want to sleep, and getting up when I want to get up, and cooking for myself. The independence.
Sure.
I miss being independent.
So you're wanting to get home to your dog, your garden, back to your life, your independence.
Yes. Yes.
What do you think you need to do in order to be able to achieve that goal of getting home?
Well, they told me that I need to be able to walk down the hallway and back, even with the walker, being secure and not with the wobblies. And I haven't gotten there yet.
And do you agree that that's what you need to do in order to be able to get home?
Yeah. I don't want to fall. I've had friends that had that happen. So I agree. With some hesitation, but I do agree.
And tell me how your physical therapy's going.
Oh, it's better. It still hurts. I'm getting better. I'm getting better. It's not quite as painful. Yeah,
So it sounds like you can see that you're making some progress in physical therapy.
Yes.
And that you were hoping that the Tai Chi would help you with the wobblies.
Yes. Yeah.
And so are you wanting to go back to Tai Chi?
Yes. Yes, I do, because my friend, I think I told you, really, really loves it, and I just wish I could go back, and yes, I do. I'm not making much sense, but I do.
I think it's important that you know that you're the one who has to make the decision about whether or not Tai Chi works for you.
Well, I don't really know yet after just one time. Yeah, it's I can't make that. It wouldn't be fair for me to say it does or doesn't. It didn't that one time, but
So you haven't seen the results that you want yet, but
Right.
because Dr. Fields has recommended it and your friend has,
Yeah.
and it sounds like you liked the instructor.
Yeah, I do.
Sounds like you'd like to try and give it another chance.
Yeah, I would.
So what has to happen in order for you to get to Tai Chi again?
Well, I'd have to make the arrangements again. That was a little complicated. And I'd have to get my head straight about feeling self-conscious, because I know that nobody's really looking at me, but I have to convince myself.
Yeah.
Yeah. And the arrangements are a little complicated.
So how confident are you on a scale of 1 to 10 with 1 being not at all confident, and 10 being very confident that you can make the arrangements in order to get to Tai
That
Chi.
I can make the arrangement.
Mm-hmm.
5.
5.
Yeah.
Uh-huh. So
I mean, I know I can, but it's really difficult.
uh-huh. What is it that makes it a 5 instead of a 1? No confidence.
That I'm doing it by myself.
Mm-hmm.
And I would really feel, if I could have some, like if somebody could help me do it.
Uh-huh.
My daughter can't visit that often, and
Uh-huh.
yeah.
So in order for you to feel more confident, you would like some help in making those arrangements?
I would.
Uh-huh.
I would.
And is that something that your daughter can do for you?
Well, she could, but I'd have to wait at least a week.
Okay. So is that something that you'd like us to help you with?
I would.
Uh-huh.
Yeah. Yeah. Is that possible?
Sure, we can make those arrangements with the rehab center. They have a van, and they've done this for other patients, so we can certainly make those arrangements if you'd like.
That would be good. And then as far as feeling self-confident, I'd have to do that myself. Yeah.
So are there any other barriers or obstacles in the way to you getting to Tai Chi?
I can't think of any.
Okay,
That's the main thing.
all right.
The arrangements.
Well, it sounds like you can see that you're making some progress in your physical therapy.
Yes.
And that you're wanting to give Tai Chi another chance, and that if we can help make arrangements for you to get there with the van through the rehab center, that you'll give it another chance.
Yeah,
Okay.
that's true.
Well, before you leave today, we'll go ahead and I'll call the rehab center and make those arrangements.
You would?
Sure. I'm happy to do that.
That would really help.
And then when you come back in, I know you've got another follow-up appointment with Dr. Fields. I'd like to check back with you then and see how class went the second time.
Okay.
All right.
Yeah, thank you.
Well, thank you very much for coming in today, Mrs. Smith, and I look forward to hearing about the progress that you're making.
Okay.
Hi, Mrs. Smith. I'm Denise. I'm the social worker here at the clinic that's working with Dr. Fields and the rest of the team. And I know you were here to see Dr. Fields today, and I just wanted to let you know I usually work with people who are have situations similar to you, and that have gone back home from rehab. And so I'd like to find out a little bit, if you would, if that's okay, about how it's been going since you got home.
Pretty good.
Yeah?
Yeah, I'm glad to be there.
Yeah. What are you really glad about?
Well, I'm glad to see my dog.
Mm-hmm.
He's very cute. And it just feels good to be home.
Yeah.
And my garden is coming along, and my neighbors have stopped. It's good.
Mm-hmm.
It's good to be home.
I know I understand that that was your goal. That was a really important thing for you to be able to get home, and it sounds like you've been able to really enjoy parts of it. And I know you've been going to both the physical therapy and the Tai Chi, and how's that going?
Well, I didn't go to physical therapy this week, and or Tai Chi, actually.
So I'm wondering if something happened that led you not to go. You look a little down.
Yeah. Well, actually, I had a little semi-fall.
Mm-hmm.
I didn't fall down. I didn't fall down completely, but I did. I guess I still had the wobblies, and I was hoping that the physical therapy and the Tai Chi would get me further along than it has.
Mm-hmm.
I still don't have the balance, so I'm thinking that maybe I was pushing too hard, that maybe I should cut back, and kind of not try so hard to keep moving like that.
So you've been working really hard
Yeah.
through this whole thing. You worked really hard to get home.
Yes.
And you've continued to work really hard with both the physical therapy and the Tai Chi and taking care of your house and doing all those things.
Yeah.
And you had this fall or semi-fall, and you're feeling like maybe you were pushing too hard.
Yeah.
Yeah.
So I cut back, and I don't know if I should really even continue the Tai Chi because it's very demanding.
Yeah. It's a lot of work.
It's beautiful but yeah,
What are you concerned about?
that I'll fall again, or really fall and hurt myself. And this way, if I don't move around so much, there's less chance that I will.
Yeah.
Yeah.
And so you don't want to hurt yourself. And
No.
what are your concerns about? It doesn't sound like you feel like you hurt yourself in this fall.
No, I didn't. I was just more scary, and it was like a signal that maybe I'm doing too much. Yeah. And
what are you concerned will happen if you get hurt or if something?
yeah, if I lose my balance and fall down, I could anything. I'd really get hurt, and then I wouldn't be able to be home anymore, and that's not what I want. I want to stay home, so I want to do what I have to do to stay home.
And it feels like the only way that you can really stay safe and not fall is to not do anything, to kind of just hunker down.
Yeah. Yes, you put it very well.
Yeah.
Hunker down.
Yeah.
Watch the TV and pet my dog. I not to that extreme, but yeah, I think maybe I was pushing too hard. And I'm not sure about the Tai Chi anymore. I think the physical therapy, I can understand that, but I'm not so sure about the Tai Chi.
Yeah. So the physical therapy you can kind of still see that it's helping you to build your strength, which might have probably helped you break your fall this time.
Right.
I'm wondering what you remember about what Dr. Fields said about the Tai Chi in relationship to falls. Did she talk with you about that?
She did. Yeah, that's right. She said that they did studies and that they found that it was really preventative. I think I forget the percentage, but yeah, she was really enthusiastic, and she does it herself. Yeah.
So you're feeling a little betrayed. Like it didn't, I did this, I was doing my Tai Chi, and all of a sudden look at this, I fall.
That's a strong word, isn't it? Betrayed. Wow. A little, but I know that it's true. I mean, my friend who does Tai Chi, she loves it. Maybe it's just not for me,
Right.
But
so you're just starting to question a little bit about whether or not it might be what is useful, and it does really come down to what works for you and what you decide will help you stay safe. And I'd like to work with you, as I know Dr. Fields would, to help build a plan that will help you feel as safe as you can in your home.
right.
And to keep you there and to keep you feeling safe.
Yeah.
What do you think about that?
Absolutely. That because I don't now. I'm feeling really a little frightened that. What if I fall down and nobody comes around and I'm lying there for 2 days, I mean, I've heard about that.
Yeah,
And
right.
so, because I am alone.
Yeah.
So.
So it really kind of strikes you that you're there alone and this could happen. And
Yeah.
what thoughts do you have about that? What have you heard that others have done, or what thoughts do you have?
Well, I think that there's some things that could be done I know people who live in a residence, they have a cord they can pull, but how do they get to the cord? Is there anything else that I could do just to communicate if God forbid something does happen?
Yeah, yeah. I know what's worked for a lot of the folks that I've worked with is there's a, like, it's called a lifeline, and they can wear it around their neck, and it's hooked up, and so that if you need help, you can push the button.
I think I saw something like that on TV. Does it really work?
It does really work.
Because, you know, they have so much stuff on TV. It's like you can go. It's crazy. It's crazy.
No, it is something that there's a couple of different, a couple of different products out there, but it can really help, and it kind of might give you the sense of security that you have at your fingertips.
Yeah, I guess I'm feeling a little scared. You know, about that happening. And so it's probably a signal to make some changes. Like, I don't want to go back to the hospital.
Right.
I really don't. Do I have to?
No. We're going to work with you to help you stay home as long as you possibly can and be safe.
Yeah.
So what do you think that will take? Because you're the one that really knows how you're feeling about in the house and how you're feeling about your safety. What do you think? The lifeline is a possibility.
Yeah,
that's something we can consider.
I definitely want to do that. I definitely want to do that.
What else do you think it would take for you to feel safe?
Well, maybe they when I first came home, they had somebody come and show me some things in the house.